My name is Albert's Gift. I registered for antenatal at Rivchpp Health Center. So I was going for antenatal from my 4th month, or my 3 month rather. I was going there till I entered 37 weeks. So I was referred here due to they say they saw my baby poo in the womb. So when I was referred to this Mission Hospital, I came here instead of me having such 2 CS. So I was giving birth through vagina and everything went smoothly, even with the pain and everything. The doctor encouragement, the nurses support, everybody was telling me I can do it, and finally God did it for me, and I delivered my baby boy safely and sound on Sunday.
My name is Zero Happiness. I registered at NPHE Odoha Clinic. So I was having a premature labor, experiencing water and blood at the same time. So the nurse at NPHE Odoha Center now prescribed me to Mission Hospital for CS. So as I came here on Sunday evening, I mailed to the receptionist to direct me. I wrote down my name, everything. So I went to go and see the doctor that Sunday. He asked me what was my experience, why did I come to this place. I said I was having a premature labor at that very time. So then I said, okay, that I will go for CS. That I cannot deliver the baby safely because the baby was lying slide on my womb, so which I cannot deliver in the help of CS. So it was yesterday they carried out the CS, and CS was successful. They didn't take anything, no money was collected from me. It was free, and the doctor and the nurses were here. They are very good and kind. So that was my experience. I love it. I thank government for this wonderful privilege for the less orphans, because I am an orphan, so I don't have anything. So I just thank government for doing this to help people.
Good day. It's another amazing day of the Rivchpp Testimony Thursday, and my name is Kingsford Guinea, and of course I am joined today by the Executive Secretary of the River State Contributory Health Protection Program, Dr. Vetty Agala.
Good day, everyone. Thank you for joining us again, and thank you for subscribing, liking, and sharing our YouTube videos.
Thank you, and of course today is our very 10th episode, and you have sticked around with us for this 10th episode. Thank you so much. So keep spreading the word of Rivchpp. So let's go down to the videos that we just watched. The two of the women, one spoke of seeing both blood and water at the same time, and the labor came early, and the other woman said that the baby pooed, so can you just explain what they were saying, because I know that had to make them to be referred from the primary center to a secondary facility.
Absolutely. Thank you so much. Normally, after 9 months, which is about 40 weeks, is when labor processes start. But sometimes you can have a preterm labor where blood and catarrh-like water things show, and so it is normally called the show, and that heralds the beginning of the process of labor. Now, for the second woman who said that happened long before she was 10, before she was 37 weeks, that is a reason to refer her for secondary care, especially from the primary health center. For the other one, a baby pooping shows distress. So fetal distress is one of the reasons why a woman that's registered in the primary health center, who we would have thought will have a normal delivery, will be referred. Because the idea of antenatal care is to ensure that the baby and the mother are safe. So if there's distress of the baby, it means that the baby is not getting enough oxygen, or the baby is in distress, and you need to refer. And there are other reasons why women are referred. You find that we have a lot of women going for cesarean section. One of the reasons is primary breach. So if it is the first time of a woman getting pregnant and the baby is not positioned with head first, it's coming out with the bottom. Because you have not tested that pelvis, you will want that woman to go to a higher center where they have what it takes to assist that delivery, which may be a CS or even an assisted vaginal delivery. Another reason for referrals is multiple deliveries. I know that last week or so we saw two sets of twins. So when they are twins, it's easy for the babies not to lie well, for the first baby to easily come out and then the second one. Another reason is if this woman has had a previous CS. If she has had a previous CS, you don't want her to go through that labor process. Okay, now that previous CS has to be a reason that is continuous for her to not try a vaginal delivery. So there are women that had a previous CS due to maybe hypertension. It doesn't mean that in her next delivery she cannot try normal delivery. Okay, for some other people it is a contracted pelvis, so the head of the baby seems bigger. We call it cephalopelvic disproportion. So if you allow that labor to progress, it's like the head is going against a wall, so there will be obstruction of labor, and eventually that woman may need an emergency CS. So you want to refer. Ditto a large baby. So there may be room in the pelvis, but this baby is big, 4 point something, and so you want to refer. Other reasons for referral: you have tried labor, using the pathograph, which is what we use standard to monitor labor. And if the labor is not progressing and is prolonged, you want to refer. If there are medical conditions, sometimes hypertension leading to what we call pre-eclampsia and eclampsia, because if a woman convulses, she could lose her baby and lose her life. So these are some reasons. Of note, one of them is what we call antepartum hemorrhage, bleeding before it is turned, and that can be caused by two different things: when the placenta is low-lying or when there is an abruption. These require emergency cesarean sections. So these and many more are some of the reasons that a woman that registered in a primary health center, who probably may have had a normal delivery before or may have not had a cesarean section before, will be referred to a higher center for cesarean section. Now, the very first woman was referred for CS, but ended up having a vaginal delivery on the table. That is possible. Now, I've told us about the fact that at the primary health center, there are reasons for them to refer. But when you get to a higher center, they have more equipment, they have more skill, and so someone can actually deliver vaginally, even though she was referred to have a cesarean section. Thank you.
Amazing. I mean, that was very much detailed and amazing. So I want to ask a question, because I know that one of the universal health coverage goals is to reduce infant mortality. We don't want women bringing life to die in the process. And we understand that some of these women that are registered in these health facilities, these primary healthcare facilities, are in the rural areas. And before now, some of them, they had to go to other places, maybe have midwives that will attend to them, and sometimes they have complications like this, and because that's their only option, they die in the process. Now, how can you assess Rivchpp's impact as far as reducing infant mortality is concerned in River State?
Thank you very much. The health insurance and Rivchpp are very much a part of the plan of the country to reduce maternal and infant mortality. Maternal, even newborn child mortality. Now, we have what we call the mommy LGAs, for instance, and those are LGAs that we have given priority. Those are LGAs that had a high burden of maternal deaths. And I can tell you that with Rivchpp, because these are some of the problems that lead to either maternal or fetal death. And so by referring timely, these women are able to get the kind of care that they need, and so they don't need to die. Now, if you are also assessing care in the health center, it's easy for them to easily identify a problem and quickly make a decision to refer. That's why we're calling on women. I mean, I know that before now we go to the TBAs and a lot of women can actually deliver without any problem. But how do we know those women that will have problems?
Yeah.
That's why we're calling on you. Incidentally, recently we've opened up the lines for all pregnant women that go to the primary health center to register free of charge into Rivchpp under the Basic Healthcare Provision Fund if they have their national identification number. So yes, we are on a journey to reducing maternal and child mortality, and Rivchpp is at the forefront of that journey. Thank you.
Amazing. Thank you so much, man. I mean, Rivchpp is at the very forefront. So if you know a pregnant woman currently living in River State, tell that woman to get enrolled into Rivchpp. And of course, beyond pregnant women, River State Contributory Health Protection Program is for all. You don't need to be sick for you to insure yourself. The idea is to, have a form of cover in case something gets to happen. Of course, we don't pray for that, but it's very good that you get insured. It's been an amazing episode today. Thank you so much, Ma, for your time, and keep watching, keep subscribing, and keep following what we do. Remember, think health and think Rivchpp. Thank you, and God bless you for now.